All right, so today we're going to talk about a hamstring strain. Now, the hamstring group itself is made up of three different muscles. It is actually graded on a scale of 1 to 3. So grade 1 is typically just like a partial tear. The best way I kind of describe it is like if my hand was the muscle here, you're going to see like a grade 1 is just a little bit of the muscle. Grade 2 typically means a partial tear or maybe a little bit more. And then grade 3 is basically a full tear. Now, the hamstring strain is the most common injury in athletes. If you're a high level athlete, you're a high school athlete, if you're just a weekend warrior just trying to go out for a nice long run, we're going to see hamstring strains the most in the lower extremity. And that's just something that it's just because it's such a muscle group that's utilized so much in all these different sporting events that it's just the most susceptible to an injury. So typically we're going to see the hamstring strain come from either an inability to warm up properly. You may have a prior injury to the hamstring that may contribute to this as well. And lastly, you may see some kind of biomechanical shift. So the muscles themselves might be weak, or you may have some kind of imbalance in the pelvis that might be creating kind of like an imbalanced muscle pull, and that can always lead to this injury as well. So typically in the office, when someone comes in, we're going to see very local pain. If you strain a hamstring, the pain typically will be at the area of the injury. Now, as gravity kind of comes on and you kind of give it a couple hours, gravity is going to see some bruising occur, at the side of the injury, but it also might kind of travel down the muscle group towards kind of the knee. Like I said, gravity is going to kind of shift that bruising down a little bit. Now, also on the physical examination, we're going to see very local tenderness. So it's going to be very painful to touch. The patient may have difficulty kind of walking in, because that's the thing, is our walking pattern utilizes a lot of the hamstring muscle group itself. So, depending on how severe the injury is, we may see a change in their gait pattern, how they're walking. Like I mentioned earlier, you're going to see some bruising in the area, as well as you're going to just see kind of the body go into like a compensatory pattern where it's just going to just tighten everything up and stiffen you up. And then you're going to have very local tenderness upon palpation or kind of just touching the muscle itself. So let's talk about managing the condition. Now, this is one of the most challenging conditions to manage from a clinician aspect as well as from a patient aspect. 12 to 31% of people have some form of a relapse with this type of injury, because the muscle group is just used so much throughout the daily activities. You're moving, you're bending forward, all of that's going to put some kind of stress on this muscle group. Now, typically with this type of injury, each recurrent injury to this hamstring group, the research says takes about 2 times the amount of time to recover compared to like the previous one. So it's an injury that if it's not rehabbed completely and to the 100% the first time, if you do happen to have a relapse and have a re-injury to this area, it's going to take longer. This is one of those injuries that just takes time to recover. Now, typically a hamstring strain is managed in several different stages. Stage 1 is just what we consider like the pain relief stage. We're just kind of getting you out of pain. We're trying to get some of the swelling, some of the bruising down. We're trying to just allow you to just move a little bit. Typically that's going to be movement with us, kind of just moving the leg through motions. In some cases, if the injury is severe enough, patients may be may be required to kind of utilize crutches, something to take just some weight off of that muscle group and just allow it to just take a break. The best way we describe this is what we call peace and love. And I know we've kind of gone through the peace and love, and the peace and love kind of takes over with the Rice or the Price ideal that was kind of put to rest recently and through some research. Now, phase 2 is typically when we're kind of starting to kind of load the tissue a little bit. So at some point, we transition you from phase 1 to phase 2 when you're able to walk on the leg without any kind of assistance. You're not using crutches or a cane or anything like that. Phase 2 is just when you're able to kind of move without that sharp stabbing pain as you're just walking. Now, phase 2, we typically start to incorporate some soft tissue work. We do some mobilizations in the area. We can do some cupping. We can do some instrument-assisted soft tissue work, as well as maybe a little bit of dry needling. We're going to make sure that the pelvis is moving like it should be with chiropractic adjustments. And then we also start loading the tissue in the gym and just kind of start easing you back into daily activities, normal movements of this hamstring group itself. Now, phase 3 is where we really start to kind of push the injury a little bit. We start to really load the tissue. We're starting to work on deceleration and acceleration of just movement patterns and just kind of moving you around a little bit to kind of stress that tissue a little bit. But that's the point, is we got to make it resilient and kind of recover that muscle group back to its 100%. Because like I mentioned earlier, if you go back to your sport too quickly without kind of recovering this to 100%, you have an opportunity to relapse. It could potentially come back, and like I mentioned earlier, it could take longer. So this is one of those tricky injuries that we really have to focus on and make sure that we're 100%. And typically in phase 3, kind of to graduate you out of phase 3, is we got to make sure that you can do your sport related activities to 100% with no setbacks. So now that we're back into high school sports, football's kicking up, baseball, basketball, all that fun stuff. We're in the thick of it. So if you start to feel any kind of issue, or you might think you might have a hamstring strain, or someone that might have injured that, we'd love to help. We'd love to take a look. This is a condition that requires a very thorough examination. So I think we can provide that for you. Give the office a call at 513-463-3011, and we will see you soon. Thanks.